Hey everybody, I'm Dr. JC and this is the truth about eye care and your eyes. Does your child have pink eye? I'm sure that's something you've probably asked yourself if you're a parent. All of us that are parents, there's so many things we don't want our children to get. Pink eye is definitely one of them. But what exactly is pink eye? It's a very broad term, very vague term. There's lots of confusion about what it actually means. So pink eye can, a red pink eye appearance can be all sorts of different things. It can be something as simple as eye strain to maybe an allergic reaction, maybe a bacterial reaction or infection, or even a viral infection can be pink eye. Okay, so what is pink eye exactly? Pink eye or red eyes is, kind of a vague term, but what the scientific, I guess, or the technical term for that would be conjunctivitis. Now, you have to understand what the conjunctiva is in order to understand that conjunctivitis is just an inflammation of the conjunctiva. So we're going to look at this first picture here, and you see how it's got the conjunctiva there, the lining of the eyelids and the surface of the eye. So it's a clear kind of translucent, really a skin layer that goes over top of the front of the eye and the inside of the eyelids. Now if you look at the second picture, you can see a better example of that. That top one there, that's just the normal straight on view. You're going to see redness, but look at that cross section view down in the bottom right, the kind of side view there. You're going to see the lids and the lashes there to the left. Now notice the conjunctiva highlighted in red. It's kind of that little sac, kind of dips down in the inner portion of the eyelid, the front part of the eyeball. That is what we're talking about. When that gets inflamed, whether it be by any cause at all, bacteria, viral, allergy, whatever it is, that is what's going to cause conjunctivitis or pink eye. Now, the next picture here, you see some examples of symptoms that can happen. We're going to go in a little more detailed list of symptoms here in a minute. But notice the normal eye in the top picture there, or normal half of the eye, and compare that over there to the right-hand side where it's got the things that can happen with bacterial, where you've got some crusting, mattering of the lashes, you got some mucus discharge or some opaque discharge, sometimes it's yellow, green, whatever. You've also got the viral symptoms, which are not the discharge, but just a clear, more of just a clear tearing, excessive watering as your body's trying to flush that virus. Obviously you get redness and swelling, both bacterial and viral, and also a whole lot of other things, okay? Allergy symptoms can cause this, something that's in your eye can cause it, there's just, the list would go on and on forever. So don't think that every little thing, every time your eye gets red, that it's pink eye, okay? We're going to talk a little bit more about that as we go on, but I hope these slides kind of help you visualize that there are some differences between the different types of pink eye, and there are some different ways in which they present, and all of them are still serious conditions, but maybe some more so than others. The one that everybody is afraid of, the one that everybody gets sent home from work for, kids don't go to school for, or at least they shouldn't go to school for, is the viral kind. Okay, it's caused by a virus, and the reason for it being so bad is, number one, that it's so contagious. It can be easily transmitted from one individual to another. It can also be easily transmitted from one eye to another. So if it starts in one eye, very good chance if it's a viral origin that it's going to go to the second eye. Okay, and probably to other people too. It's very, very contagious. Also, the symptoms are quite miserable for a viral infection. Very excessive watery eyes, tearing, sometimes some discharge coming out, lots of swelling, and it just lasts for a long time. Very chronic irritation, inflammation, swelling, not comfortable, not something you want to have, not something you want your kid to have. But the good news is that since it is a virus, it is eliminated by the body's natural immune system within 2 weeks. There's not really a cure for it during that time, for something in the eyes anyway, but again, it is eliminated by the body's natural defenses within 2 weeks. So you're really just kind of treating the symptoms along that time frame, trying to make the patient as comfortable as you possibly can. Okay, so say you have pink eye, you come to me. I usually prescribe, to treat the symptoms now, I usually prescribe an antibiotic and a steroid combination drop, combined into one drop. So the antibiotic is really just in case. I mean, you never know, there could be a little bacterial component in it. Maybe I wasn't exactly sure if it was a bacteria or a virus, so it kind of covers both things. But the steroid, though, is what really does all the work in either infection. If it's a bacterial or a viral infection, you're going to want that steroid because it's going to calm down all that swelling in your eyes, it's going to calm down the redness, the inflammation, just make you feel better in general. Now the antibiotic, of course, is still important, so you're still going to get that too, all in that combo drop. If you have a child who is under 2 years of age or so, then you're probably not going to get a steroid. That's not really safe for children under 2. So in most cases with a child under 2, you're just really going to get an antibiotic drop. I mean, that is going to make them have to deal with the symptoms a little bit more, but like I said, the virus runs its course, 1 week, 2 weeks or so, and it's gone in most cases. So you know, we want to be safe for your child, and you know, eventually they're going to get through it. So say you go to an urgent care center or maybe an emergency room for treatment for your pink eye. Probably not the best idea. There's a lot of people there, first of all, that have much more serious conditions that need treated, so you're taken away from their care. But you really need to see your eye doctor, because we can prescribe the best things for you. You know, if you go to one of those places, you're likely going to just get an antibiotic drop, and that's it, which, you know, is not really going to help if it's a virus. And, you know, I see a lot of patients for that reason that have been on the antibiotic drops. They've done that, they've been on the drops for 3, 4, 5 days, and they're still not noticing any signs of relief, and they come to me saying, help me. So, you know, then I do the antibiotic steroid or something like that. But, you know, you need to just get out and see your eye doctor if you have an eye problem. Now, it's really hard for me to answer the question, how long am I contagious for? Everybody wants to know, how much work do I have to miss, how long do I have to stay home, all that. You know, your body, once your body starts mounting the immune defense against that virus, you know, you're really, even when you get to where you're not contagious, you're still feeling pretty bad. You know, the symptoms are the last thing to go. I would recommend, if you think that you have anything that might be connected to a virus or something contagious at all, that you just stay home. I mean, for a few days at least. You don't know who you're going to come in contact with at work or around in public that might have some kind of immune deficiency. I mean, you could be threatening their life. So it's best just to stay home if you have something, even if it's an eye-related thing. If it's contagious, it's contagious. So just stay home and do the right thing. All right, now, so I'm going to leave you with this little list of symptoms here as we close this video. If you look at the list here, you're going to see some common eye conditions or eye symptoms that can be associated with pink eye, not necessarily just that, but if you're getting mucus discharge, if you're getting excessive tearing, mattering, crusting around your lashes, your eyelids swollen, even to the point that it's swollen shut, that should be a dead giveaway. You need to see your eye doctor. But any of those things, you need to get in as quickly as you can. If it's gritty, uncomfortable feeling, even just excessive itching or redness, then you know that's something that you probably still want to get checked out by your eye doctor. And of course, pain. Okay, I mean I think that's a given. That can appear in a lot of different ways, though, with an infection, like the kinds that we've talked about, or it can appear with eye strain or improper prescription, headaches, muscle strains. There's a lot of things like that you just want to go and see your optometrist for. So as we close this video, I hope it's been helpful to you. I hope that you know a little bit more about pink eye now. If you have any more questions, leave them in the comments. I will try to follow up with another video to answer some other questions if there are a few that maybe I didn't address. So hope you liked the video, and I hope you'll keep watching the next ones. I hope you have a great day, and I'll see you in the next video.